welcome to Hashimoto's Unfiltered, real talk, real solutions. The podcast where we cut through the noise and get straight to the heart of living with Hashimoto's. My name is Dr. Ray Benedetto, your host, and I'm here to share my expertise, personal insights, and from time to time, conversations with incredible guests to help you take control of your health. Together, we'll explore actionable items, debunk myths, and navigate the complexities of your thyroid health. So whether you're newly diagnosed or a seasoned warrior, this is your space for unfiltered truth and real hope. Let's dive in. I want to talk today about the frustrations that I know you guys all experience because you get sick of hearing over and over and over and over again that your labs are normal, nothing's wrong, and you feel terrible, right? You got all these symptoms, you go to your doctor for help, they run tests and they tell you nothing's wrong. And it's incredibly frustrating. I get it. And, at its core, we'll start with like the 30,000 foot view and then we'll kind of drill down. But at its core, it's treatment paradigm. In the mainstream medical world, your primary care doctor, your endocrinologist, I don't care who it is, your Swami, whoever it is in the mainstream medical world, all they're ever going to do is run surface level blood tests. And if everything is within the ranges on those surface level blood tests, there's nothing to do. There's nothing wrong. That's it. Even if at some point along the way you were diagnosed with a thyroid problem, because your levels went out of range and they gave you the thyroid hormone replacement medicine, right? Like Synthroid or whatever, that all they're going to do is continue to check your TSH and continue to adjust your dosage based on that number. They are not going to treat you. They're looking at one test, they're looking at a TSH on a piece of blood work. That's what they're treating. They're going to treat the labs. They're not going to treat you as the person. I say this all the time to you guys and all the time to my patients. We have to treat the person with the diagnosis. We don't treat the diagnosis in the person. Totally different paradigm shift. Mainstream medicine, they're going to treat the diagnosis. They're going to treat the blood work with pills, and that's it. And as I've talked about ad nauseum on here, and we'll touch on it again today, when the problem is Hashimoto's, that's not going to help. It's not going to do anything. For you guys trying to get your doctors, your medical doctors, your endocrinologists, your primary care doc to do anything other than that is a waste of your time. You might as well be speaking Chinese. If anyone here speaks Chinese, that's great, but I don't. And most doctors don't unless they are Chinese. But you might as well be speaking a different language to that doc because it's hard enough just to get them to run a full panel of thyroid tests, let alone and do anything about it or actually treat you as the individual. So that's the paradigm shift, right? In my world, in the functional medicine world, this is the way it's supposed to be. Unfortunately, this gets bastardized a lot of times. Again, you guys have seen programs out there that are all cookie cutter and not really individualized to anybody for a lot of money, unfortunately. But it's got to be individualized to the person. You have to take each person into account and it has to be personalized to them. What kind of tests do they need? What kind of foods do they need to eat? What kind of supplements do they need to take? Like, it's assessed individual on an individual level. Treat the person with the diagnosis, not the diagnosis in the person. Trying to get your medical doctors or your endocrinologists or anything to do it that way is never going to happen. They're not trained that way. They don't learn that way. That's not how they practice. That's not how they operate. They operate, look at TSH. When it's elevated, here's your medication. When it's back in range, we're done. Now, that leads us to the second problem, right? Is that many times they're only doing TSH screenings. That's it. They're doing one test. TSH. And so I get this from people all the time. They'll be like, they'll message me, they'll post in the group, we'll talk on, consultations, and they'll be like, my doctors keep checking my thyroid tests and they're telling me they're normal. And I say, okay, well, define thyroid tests for me. Like, let me see your labs or tell me what they're checking. And most of the time it's TSH only. And that's not all of the thyroid tests. It's one. It's not even the best one, but it's the one they use because that's how they dose the medications or that's how they make a diagnosis of hypothyroidism. So tests, all these, your thyroid tests being normal, most of the time just means that your TSH is in range, and that's a giant range to begin with, right? So we'll come back to that. Nowhere near a full thyroid panel. Not checking hormone levels, not checking antibodies, not checking any of that stuff. So that's another thing too. If you're being told you don't have a thyroid problem and your blood work's normal and you're in range, are they only just checking TSH? Most of the time, yes, that's the screening test. That's all they do. If they are checking more, because a lot of times all your other levels are in range, like TSH and your T4s and T3s, but your antibodies are out of range, right? There's a lot of antibody talk in the group today. People are like, yeah, my antibodies are sky high. You can have all your other thyroid markers be in range and your antibodies are sky high. You have Hashimoto's. They're not going to do anything about it. They're not going to lift a finger because your TSH is in range. And they're not doing anything until your TSH is out of range. And even then, it's just here's your meds, which is going to bring the TSH back into range, and then they're done. And you're not better because it's not fixing the problem, right? The underlying problem is Hashimoto's, which is an autoimmune condition. It needs a completely different treatment approach because that ain't going to do it. Then the third thing is that blood work in general, these ranges that they use on these tests are huge. Like you have to be half dead or pathological. There has to be a disease state going on for you to fall outside of these ranges. And then and only then are they going to lift a finger, and it's only one finger, not 10 fingers, right? They're going to lift one. So we need to look at tighter ranges. We need to look at the optimal ranges for these blood tests. And I do this a lot for patients is take their blood work and be like, all right, give me the labs, this gigantic range. Yeah. And here's the thing. Most of the time you're like right at the edge too, right? Like, so it's like TSH, like 0.5 to 4.5 and you're 4.4. Well, you're in range. You're fine. Come on. First of all, it's out of the optimal range. Number two, it's a click away from being out of the lab range, which if we took this blood work tomorrow, it might be. So we need to look at this blood work through a different lens as well, right? So I'll look at optimal ranges so we can treat people and get people better and catch things before they become end-stage disease. Medicine is only functions in the world of end-stage disease, right? So once you got a disease, and now we can diagnose it, here's a pill for it. It's nonsense. That's why so many people are suffering with thyroid issues, Hashimoto's mostly. No one's getting better from it because that's the way they're getting treated. They're getting one test done. It's TSH. If it's in range, there's nothing wrong with you. There's nothing wrong with your thyroid. If it's out of range, here's the pills, bring it back in range, we're done. If Hashimoto's is the cause of the whole darn thing in the first place, which is an autoimmune condition, that scenario that I just played out does nothing to treat it. Nothing. So that's why labs are normal. I'm on my meds. They're telling me my labs are normal. I'm on this dose of whatever, and I'm not better. It's because we haven't looked for Hashimoto's or any other tests on the thyroid to begin with, or B, we have identified it. Nothing's being done about it, and because nothing is going to be done about it. Mainstream medicine doesn't treat it. They don't. It's insanity because it is the cause of everything. So we have to treat it. People get to me, I'm like, forget your labs. I'm like, sure, send me your blood work. I want to take a look at it. Forget it though. We got to look at you. We got to see what's going on with you and figure you out, because there's a different combination of things for you that are causing the Hashimoto's. They're going to be different than the next person, even with the same diagnosis, right? The same end result. But what are the things that all added up to cause it? So we have to look at a different lens at the patient and individualize it. Yeah, I get people coming all the time. They're like, my doctor's just treating my blood work and they're not treating me. And I need someone to look at me, look at my case, look at my health, figure this thing out and get me better and walk me down that path. Perfect. Someone says that to me, we're going to get along just fine because that's exactly what we have to do. That's exactly what I do. Step 2, it's Hashimoto's. Okay. Now we need to identify what are the root causes of your Hashimoto's. What are the underlying issues? Is it foods? Is it leaky gut? Is it chronic infections? Is it hormone imbalances? Is it genetic or DNA issues, right? We talked about MTHFR, a lot of chatter today in the group. So then we got to figure all this stuff out. And again, it's going to be different for everybody. Like I run testing on people to do that, but it's not the same tests for everybody. Like it's not like everybody who comes in gets these same tests. It's like, no. Okay, these are the things we need to look at for you based on your history, based on your blood work, based on, everything that you're telling me and all this stuff. That's why we have to do all that hard work, that detailed work on the front end when I start working with someone, like a detailed health history and all this kind of stuff, because not everybody gets the same cookie cutter approach. It doesn't work like that. So we got to figure out someone's root causes, get all those cards on the table. And then the third step is, okay, now that we've done that, now we can start addressing these issues. Now we can work on their diet. We can do prescribe targeted nutritional supplementation that might be needed. We can put together a long-term specific eating plan for them. And what foods do I need to eat? What foods do I not need to eat? Like, so that, what supplements do I need to take? Again, these are the things I hear the most out of you guys. It's like, I need someone to treat me, not just my blood work, because that's not getting me anywhere. I need to figure out what my root causes are, because until we do that, we don't even know what to do. And I need help with knowing like what foods to eat, what foods not to eat, what supplements to take, all that kind of stuff. And it's spot on. Those are the things that need to be done. You're never going to have this conversation with a medical doctor or endocrinologist that's going to even say these words. They're going to say, we checked your TSH. It's normal. There's nothing wrong with you. Nothing wrong with your thyroid, which there might not be. You might have an autoimmune disease that's affecting your thyroid, but they don't know. They didn't look. Or, yeah, you have hypothyroidism. We're medicating you. Your TSH is in range. We're done. That's it. That's all you're ever going to get, gang. That's it. And I'll keep banging the drum. I've said this umpteen times on these live streams. They're not going to come. No one's coming to save you. Like, that's why I have this group, is because you need to educate yourself. You need to be proactive. You need to be empowered. You need to take charge of your own health. Your doctor is not going to do it for you. I mean, if you're working with me, I'll help you do it, but your medical doctor is not going to do it for you. Your government's not going to do it for you. Your job's not going to do it for you. Your health insurance isn't going to do that for you. They're not going to. You have to arm yourself with the knowledge, the education. That's what this group is for. That's why I have so much stuff in here for you guys. And that's why I'm here to help you get there, so you can understand what the problem is, figure out an individualized plan, put a treatment plan in action that's actually going to address the root causes and get people better. Get this thing figured out for the person, and then get it better, because that's the only way that you are going to get better. It's the only way that we're going to get rid of all these nasty, terrible symptoms that come from the Hashimoto's, the weight gain, the fatigue, the anxiety, depression, the hair loss. I mean, you guys name it. You guys, I could rattle off every symptom in the book that you guys that complain about. They're all coming from the Hashimoto's. So we got to get that handled. And then that stuff goes away. It's just never going to happen in mainstream medicine. That's why they're telling you your labs are normal and you feel terrible, because they're barely scratching the surface on even fully investigating the cause of your symptoms, let alone doing anything to treat that cause. They don't. I want to thank you for tuning in to Hashimoto's Unfiltered, Real Talk, Real Solutions. Again, my name is Dr. Ray Benedetto, and I hope today's episode helped to give you the tools and the insights you need to take another step forward on your Hashimoto's journey. Don't forget to subscribe, leave a review, and share this episode if you think someone could benefit. You can also connect with me on Facebook at Dr. Ray Benedetto and on my website, drraybenedetto.com, for more resources and updates. Until next time, remember, you're not alone, and real solutions are always within reach. Take care and be well.